Hello, everybody, and welcome to Functional Medicine with me, Dr. Howard Robbins. As you know, our show is dedicated to safe, effective, natural ways of treating medical problems. Sometimes medical problems that can't be treated any other way or effectively any other way. We're here to not just help you improve your medical condition, but hopefully eliminate it permanently, completely, once and for all. I hate to use the C word cure because that makes a promise and guarantee to a result. And I don't think any doctor should morally, ethically, or honorably promise or guarantee something, even if you're successful. 10,000 patients in a row, you never know what's going to happen on 10,001 for some reason. But putting that aside, the things we talk about in the office and what we suggest you can do has been proven now over my 52 years as a doctor, and almost all of them, sure, let's say 52, about 47 of them in what we now call functional medicine. It went through a whole change of names from natural medicine. Now it's functional medicine, and soon it's going to be called, I hear, precision medicine. And we are all doing the same things over, adding on new at times, but doing the same things again and again, and getting wonderful results. They just changed the name of what it is. Today, this show is dedicated to prostate disease. This is a men's show. Women, you may want to listen to it because you like following our show. You listen to all the shows. At least you'll be able to sympathize with what men go through, as we should be sympathizing with what women go through. But definitely, this show is dedicated to men because men have prostates, women don't. Just in case you don't know, okay. Women have their anatomy, men have ours, and it comes with issues as we age, though it can happen at younger times in life. Though it's going to be very important to you, men, listen to this now, and you want to go and write it down. So get a pen and paper together, because you're going to want to write down the name of our sponsor and their website. You're going to learn why. It's promolife.com, 888-742-3404, 888-742-3404. And my other sponsor is Doctors Biome, DoctorsBiome.com. Sounds like biome, but it's biome. DoctorsBiome.com. You're going to want to get in touch with them if possible, and you're going to learn why as we go through the show. Let's get right to it. And by the way, please remember to subscribe. All right, maybe only going to listen to one, but I wish you would subscribe to the channel. It certainly helps make us come up faster so other people can find us, because when they're looking, if they don't know that we're an important enough show for them to listen to, they won't listen. They'll go to somebody else that may not give them. Hopefully, I think we're giving you very important, useful information. So you're basically when you're dealing with prostate, you're dealing with BPH. That's an enlarged prostate. I know I have it. I've been dealing with it very effectively over the years now. Then there's prostatitis, which is just an inflamed prostate. And then, of course, you have prostate with the C word that I don't think I can say on YouTube because they already took that channel down. And then you want to go, if you have that most severe type of prostate issue that a man can have, then go to a show that I did called The Special Show. It's very important that you listen to that show, The Special Show, because you can't use the C word safely on YouTube. They take your shows down then. There's a lot of, I don't try to go into diagnosis because I spend a lot of time in past shows over all the years, that I've been doing podcasts describing everything you already know. You're listening to this show because you want to get an answer to it, okay? You want to get an answer to it. And that's what my shows are dedicated to, giving you safe answers. So first, you need a healthy gut. Go to doctorsbiome.com. Why? The gut connects to the prostate. It's called the gut-prostate axis. Most people have taken antibiotics even once in their lifetime. They eat red meat or chicken that isn't organic or farm-raised fish. I don't care if you burn the meat, you're going to get uncooked out doses of antibiotics. So you have to replenish the good boys. It's very important on a daily basis. You can listen to the shows that I've done on the gut and on probiotics, and you'll understand in depth why that's so important. But go to doctorsbiome.com, and it's not an inexpensive product because there are 15 patented strains created to survive the stomach over 90%. Capsule, powder, and tablet probiotics are destroyed over 90% if they come back to life out of suspended animation where these delicate creatures have been destroyed when they freeze dry them. And then they're also created to stick to the wall of the gut, which is where you need them to get the gut healthy, getting yeast in balance and killing off bad biome that's living in there. So this is essential. Use my coupon code that I get for my patients. I'm now starting to give it online now, may as well help people out. Howard35. If you use the coupon code Howard35, you get 10% off the retail price. And if money is a big issue to you, because it can be for many people in this day and age, go on auto ship. You get an extra 10% off, so you're getting 20% off. You can cancel anytime. Has a 100% money back guarantee. You should be getting a pen and paper together if you haven't already done it. Otherwise, back this up and get it again. And then, so you need to get a healthy gut. The next thing is vitamin C. I want you to take vitamin C 5 or 6 times a day, and it has to be a high quality vitamin C. I don't give out names because they're not sponsors. It's not appropriate. As you can buy whatever you like. Make sure it's not necessarily very expensive, but it has a very good reputation, lots of good reviews. It's a high quality vitamin C. So it's and I've done shows on that. So it's bioabsorbable, bioavailable, and bioutilizable. Okay? Very important. You want to take it 5 or 6 times a day. 5 or 6 times a day. Okay? 5 or 6 times a day. That's how important it is. Why? It's only in your blood 2 hours, and then you urinate the rest away. Now, men with prostate problems have urination issues, but you have to have adequate hydration. So you have to drink at least 3 or 4 liters of water a day. With men, you want to stop absolutely at least 3 hours before bedtime. Drink enough water to wet your mouth, to wet your whistle a little bit if you have to. But 2 to 3 hours. 2 to 3 hours before bedtime. You want to stop with the excess water so that you don't have to wake up excess times each night to go to the bathroom. And you'll know that everything I'm telling you is working because you won't wake up as many times each night. You don't have to constantly go for new PSA testing or other methods that they can use to test to see what's going on with your prostate. There's a Dr. Bard in Manhattan that uses a 3-dimensional, General Electric 3-dimensional ultrasound, and he can actually see your entire prostate, actually all your internal organs. I've had it done. And determine if you have a prostate with a C word to it, or if it's just BPH or prostatitis. Direct IV ozone seems to be the best way to go for prostate, but hyperbaric high-dose ozone with multipass once or twice a week, if you have big, strong veins, can also be beneficial for it. We do both in our office. You can listen to our show called Intravenous Ozone Therapy, Everything You Need to Know. I go over the details about those two methods, Robbins method, RMDIV, and HBOT, hyperbaric high dose ozone with multipass, nicknamed 10 pass. So you can listen to the details on what it is. Trust that I've been doing it now for 40, for 35 years, 34 and 3/4 years, and over 425,000 treatments, more than any one clinic in the world, more than all the doctors in North America put together, I believe, at this moment in time, at least. And we've seen many people who have had these issues that we're talking about have complete reversal. Complete reversal. I hope you heard me. I don't like to use the C word because we're so litigious in this country, cure. We're so litigious in this country, you can be held responsible. And even if you're successful, 10,000 patients in a row, you never know what's going to happen on 10,001 for some reason. So I'm kind of cautious about using that word. But complete reversal. There's MRIs that can, detect these things as well. Different ways that it can be diagnosed. I am not in favor of biopsy because you have that prostate with the C word. I believe it can metastasize it. So I am not a fan of doing biopsies. If you've been diagnosed with it, fine, treat it. And PromoLife comes in, very importantly, at promolife.com, and call them at 888-742-3404, 888-742-3404, and get set up for home care ozone therapy. What you get is a small medical ozone generator, okay? A small medical ozone generator. And with that ozone generator, you can do rectal insufflation, which is a comfortable ozone enema. And you should be doing that twice a day at least and in around a 40 microgram concentration and at least 750 mLs of gas, cc's of gas at that 40 concentration. You'll also hear them talk about concentration in gamma, a stupid word, means nothing, but it's micrograms per cc or ml. So a 40 concentration and 750, at least twice a day for it. Now, so you have water, vitamin C 5 or 6 times a day, doctor's biome, okay, and rectal insufflation, or the more powerful ways when you're really worried and concerned, if you can find doctors that I've trained in RMDIV, that everybody can get because it uses little itty bitty veins with little itty bitty needles, and it's painless and safe. We've done it over 375,000 treatments. So I've kind of proven, New York State, if I kill you with a pharmaceutical, they don't care. If I hurt one person with ozone, I'm out of business. And God knows what else they'll do to me. Proven benefit and proven safety and proven effective. If that's all you do, that may be all that you need to do. But there's more. There's nutrients you can take like zinc. Normally, I don't tell men how much, but 40 to 50 milligrams a day. All right. And you need a zinc that's highly absorbable. I don't know if zinc piconolate is still the best form of zinc to take, but you want to check these things out. If you need to, go see an alternative, what we call a functional medicine doctor. Could be a naturopathic doctor, an MD, a DO, somebody who specializes in the nutritional approaches. Bee pollen. If you're not allergic to the bee pollen, it's anti-inflammatory, anti-androgenic properties. Glycine, vitamin D, vitamin E, in the gamma tocopherol. Vitamin E is tocopherol, and there's different versions of it. And the gamma tocopherol is especially apparently beneficial for men, for BPH and for prostatitis, and the other one. Lycopene, which you get in tomatoes. So eating a lot of raw food is very good. Raw vegetables, that is, not raw meat. Raw vegetables. I haven't eaten meat or chicken in 45 years. But a raw food diet predominantly is very good, but you'll find lycopene in tomatoes and other fruit and vegetables like papaya and pink grapefruit and watermelon. These are all healthy. Herbs such as saw palm. Oh, I'm going to give a bonus here. Definitely go to the Beljanski.com or whatever they call it. Beljanski. Beljanski. And they have an amazing product, no matter what form of prostate issue you have. Okay, it's called Prostabel. It's an herbal formula. It's amazing. Tell them, doctor, call them and tell them, doc, don't just go online and buy it. Call them, tell them Dr. Robin sent you. I don't know if they'll do something special for you, but tell them Dr. Robin sent you, and maybe they may give you a discount. I don't know. I'm not saying they will. You can always ask and have them say no, but tell them I sent you. They'll treat you like gold. Okay? Prostabel, and you want to do 10 capsules a day. 10 capsules a day of Prostabel. Not a cheap product. It's worth every penny as well. There's other things you can take, like saw palmetto, and you can take green tea, drink green tea, or take organic green tea, or take green tea extract, pumpkin seed oil, African pygeum, nettle root extract, cat's claw. There's a whole bunch of herbs that can be beneficial to men to reduce inflammation and reduce things. If you want to go homeopathic, you need to get homeopaths homeopathic doctors that are skilled to know which ones to give you. Also, you might get some benefit from, definitely you'll get benefit from chiropractic. You have to have the right nerve innervation to all your organs. And if your back is out of alignment, particularly low back, you're not going to get the right innervation to your prostate. So it's definitely important to go at least once a week to a chiropractor or osteopath for adjustment. In addition, acupuncture could be beneficial if you can find a highly skilled acupuncturist. A lot of people do it. Not all of them are great at it. You can be off by a fraction of an inch and you're a mile away. You got to be skilled at acupuncture. So key things to take: doctor's biome, rectal insufflation if you can't get IV ozone anywhere. And I wouldn't waste my time on all the different methods of IV ozone. That's why listening to that show is important, so you hear some of the other methods. Because if they're not going to have any real benefit, you just wasted your time, your effort, and your money. And you can't afford to waste time, effort, and money. If you have questions, call me in my Manhattan office at 212-581-0101. That's 212-581-0101. We don't just let new people come in. I have to speak with everyone. I want to make sure we can help you before we let you make an appointment to come in. I'm weird that way. Compared to doctors who will just let you come in and take your money and say, I'm sorry, I can't help you. In addition, you can email me at Ozone Doctor, OZONEDOCTOR, all spelled out one word, at yahoo.com. Ozone Doctor at yahoo.com. I've given you the other places to go. I want to thank you for listening. And please tell everybody you know to subscribe to our show. Please subscribe. Even if this show benefited you, just as a thank you, a payback, subscribe. I hear my techies tell me it's very important that people do that, so that we become more noticed on YouTube and the internet. So that would be a wonderful thing. Thank you very much. Have a great day, and very good luck to you if I never get to meet you with your medical problem. I want to say thank you and bye now.